to trickle in. Welcome to the Hennepin-University Partnership Winter Webinar Series. My name is Sarah Sandgren. I'm a graduate assistant with the Hennepin-University Partnership, also here with HUP Director Scott Vargo. We're happy to welcome so many of you who have been attending some of our recent virtual events and also to introduce the HUP to some new friends today. The HUP is a strategic partnership between the University of Minnesota and Hennepin County that aims to connect these organizations at points of mutual benefit with goals including catalyzing research partnerships, engaging students to provide experiences for learning and building the future workforce, and to share expertise, best practices, and knowledge, both academic, operational, and beyond, something that we hope we will do for you today. I'm excited to introduce our presenter in just a moment, but wanted to share a few virtual Zoom reminders for our audience. Your video and audio are not enabled, but please use the chat function if you need any support from us. And if you'd like to submit a question or comment, you can do that through the chat or the Q&A. You'll find buttons for those functions along the bottom of your Zoom window. We'll monitor questions throughout the presentation and our presenter will address those at the end. This webinar will also be recorded. Please look for an email from us, hup@umn.edu tomorrow with some follow-up information, including a link to a survey and the recorded webinar as well. And finally, we're so glad to present or to welcome our presenter today. Dr. Beth Lewis is professor and director of the School of Kinesiology in the College of Education and Human Development at the University of Minnesota. Professor Lewis's research broadly focuses on examining the efficacy of behavioral interventions for increasing physical activity, including looking at which variables like social support or enjoyment of physical activity are important for activity behavior change. Recent work of Dr. Lewis has looked at the effect of exercise on mental health and the efficacy of particular types of training for improving physical activity adherence. With that, I welcome our presenter, Dr. Lewis, and turn it over. Thanks so much.
Thank you, Sarah, for that introduction, and thank you for having me. I'm happy to be here. So what I'm going to talk about today is exercise adherence. And if you exercised already this morning, give yourself a pat on the back. If you have plans to exercise today sometime, congratulate yourself. If you do not fit into either of those categories, it's okay. We'll talk about that. So we will talk broadly about physical activity. So here's what we're going to talk about today, kind of 5 key areas. One is I want to give an overview of physical activity guidelines. How much physical activity should we be doing and how well are we doing at meeting those guidelines? We'll talk about sedentary behavior, and that's something that has gotten recent attention more, not just about being physically active, but how do we reduce sitting time as I'm sitting here talking to you all. And then I thought I couldn't do this presentation without talking a little bit about COVID-19 and how that may be impacting our exercise rates and some of the challenges with that. And then I'll talk specifically about our research that we've done in my lab in terms of looking at physical activity interventions and how to increase physical activity among the general population, and then also how it impacts mental health. And then I'll end with some practical implications for policy and practice based on what I talk about today. Okay, so first up, like I said, I want to talk about the physical activity guidelines and then how well we're adhering to those guidelines. Many of you probably know what the guidelines are. They came out originally many years ago, but the most recent ones came out in 2018. So basically, these guidelines began originally, the most famous one that sort of had the most systematic specific guidelines in 1995 that sort of impacted my work. And then it's come out typically about every 10 years after that. And they've been slightly updated, and we'll talk about that in a minute. But basically, physical activity has been engineered out of our lives. For those of you who may have teenagers, this is what my 2 teenage boys look like on a daily basis. This is not them, by the way, but I do protect their confidentiality a little bit. But this is what they look like in terms of and food in their room. And so basically, this idea of sitting is the new smoking. So we basically made it very easy for us to sit throughout the day. And I think it's getting worse with many of us working from home. So here are the guidelines. And again, many of you might be familiar with these, but these are based on the 2018 update. It's adults should be doing 150 to 300 minutes per week of moderate intensity activity. So moderate intensity is something that feels like a brisk walk. It gets your heart rate going. It's not as intense as sort of a jog would be. 75 to 150 minutes per week of vigorous. So you could do one or the other, or a combination of both. And vigorous is something more like a jog, something that's going to get your heart rate going much higher than a brisk walk. So we always say something that is physical activity is we make it so much like, let's say you're late for an appointment and you're rushing, or you're trying to catch a bus, or you're trying to get out of the rain. So something that's going to get your heart rate increased, and that would be at the minimum moderate range. The part of the recommendations that often gets overlooked is the muscle strengthening part of it. So people should be doing muscle strengthening 2 days per week. And a lot of times when we, as physical activity researchers, are looking at if our study was successful or not, we often forget to look at, are they doing muscle strengthening or not? One of the changes for the guidelines I want to note is that it used to say 150 minutes or more. And so now they're doing this range, whereas 150 is really the minimum. And this 300, 150 to 300 or 75 to 150 is really supposed to encourage people to be kind of on the top end. So more is better. We'll talk about sedentary guidelines in a minute, but in general, the guidelines will say move more and sit less. Children need to be doing at least an hour a day, and they specifically recommend that children do vigorous 3 times a week. This is women during pregnancy. This has changed a lot since I had my first child 17 years ago. But now they say that you can do at least 150 minutes of moderate intensity activity per week, that you should be. Kind of when I was pregnant, I remember saying you can if you want, but now it's like, no, you should be doing exercise during pregnancy. And they say that you can continue a vigorous intensity physical activity program if you had started one before pregnancy. So it's okay to start a moderate intensity program during pregnancy if you were not active prior to pregnancy. Not okay to start vigorous, but you can continue vigorous. I'll talk about this a little bit throughout. I try not to inundate people too much, but I've done CrossFit for 9 years. I don't know, many of you probably know what CrossFit is by now. When I first started, not a lot of people knew about it. But basically, we do pretty intense workouts that can include burpees, pull-ups, Olympic lifting, all sorts of running, rowing, those kinds of things. And we basically get ranked every day based on our scores that we put in, and we kind of compete against each other in the class and throughout the rest of the classes. And so I've seen women do pull-ups all the way up till they deliver their baby in that class. So I've seen a lot of people continue their CrossFit and doing vigorous intensity activity just fine. Older adults, similar recommendations. There's also kind of a focus on balance and doing both aerobic and muscle strengthening activities as well. I don't need to probably go through this much in terms of the benefits of physical activity, but there's both physical, type 2 diabetes, reduced risk of being overweight, increased cognitive functioning, decreased risk of cancer, some types of cancer, depending, and better decreased risk of depression, anxiety, better sleep, better mood, and so on. So lots of benefits of physical activity. The hard part is getting people to actually exercise. So talking a little bit about weight loss and physical activity, this always seems to come up in our research studies. We will tell people that weight loss can be a side effect, but it's really not the focus of our interventions. It's more focusing on being physically active for the health benefits and for the psychological benefits. I keep doing lit reviews on this to try to figure out, is there new data to show that what's going on here with how physical activity impacts weight? And there is some data to say vigorous intensity activity might have a better effect on weight, but really it oftentimes comes down to diet. I've seen researchers say it's 80% diet, 70% physical activity. But there is one finding that's sort of been consistent, is that doing an hour a day. So once somebody loses weight, to try to do an hour a day to maintain it. And that we, as physical activity researchers, we hate to tell people to do an hour a day because they might not do anything, because it seems too daunting to do that much. that many minutes a day. Okay, so in terms of meeting the guidelines, how are we doing? We are not doing well. In terms of, we are very good at finding ways to not be active. I think it's funny that people are taking an escalator up to a fitness center. To me, that's like the perfect warm-up exercise, is to walk up those stairs. But definitely figuring out ways to circumvent being physically active. In terms of the exact percentages, about 35 to 55% are considered insufficiently active. I actually think this number is higher. That is based on self-report interviews. When you actually put an accelerometer on somebody, like a kind of something that looks like a smartwatch, they find that about 95% are insufficiently active. So only about 5% are meeting recommendations. Many adults who do some activity are often not active enough. And one of the things that happened in the data over time is it looked like we were actually doing better for a while. And there have been some actual increases over the last 20 years in terms of being a little bit better on our physical activity levels. But they changed the way they asked the question in the BRFSS, which is the surveillance survey that they use to assess physical activity. And they said, oh, make sure to think about when you're active at work or at home. And so they changed the question. So now I think more and more people are over-reporting how physically active they are on these measures. Physical activity in children, basically the activity levels decrease in a linear relationship. Over the lifespan, there's a big decrease between children and adolescents, and then as adolescents emerge into adults. And just because somebody is highly active when they're young does not necessarily mean that they'll become physically active adults. So it's something that, sometimes kids are in sports and they're active and they're not thinking about it, but then how does that translate when the sports are over and they emerge into adulthood? So it is one of those things where we need to sort of be working with kids to make sure that they're learning to love to be physically active when they're young, so that they can, for the sake of being physically active, so they continue that into adulthood. We've seen big changes in the way physical education is done. When I was a kid, it was like floor hockey, square dancing, and learning all of these different kinds of things to do, sort of structured wise. And now they might just play tag or do some things that gets everybody moving and physically active, that really translates to adulthood. I shouldn't say that physical education just does tag. I'm just saying example. They do fun games and they do things that kind of get them moving and more educational than just doing sort of learning how to play floor hockey, for example. So physical activity by age, you can see that there is a huge, so you look at the number doing low or none, and you look at the white square. You look at the 12 to 17-year-olds where they're at, and then it significantly increases. You see a big increase from 17 to 18-year-old, and then also from that 18 to 24 up to the 5 to 34-year-old range. And then again, another increase with older adults, typically above 65. So just to kind of summarize, basically overall, there's adherence to physical activity is low. Tends to be a little better in some of the European countries where active transportation is part of their lifestyle. But generally, it tends to be low in developing countries where the physical activity is not needed for occupations, for most occupations. Amount of time engaged, like I said, declines with age. Men tend to be more vigorously, do more vigorous intensity exercise than women. It used to be that men did more exercise than women did in general. That gap is narrowing some in recent years. So we're seeing a little bit of more of an increase in women. We also know that low-income groups, both and ethnic minorities, tend to participate in less physical activity than the rest of the population. So definitely, I've seen a lot of research studies lately trying to specifically address different populations that tend to be less active. And education level is directly related to physical activity. The more education, the greater the physical activity. Okay, so that gives you a little bit of a sense of who's active. So how do we measure it? So there's two issues here. We have researchers who measure it, and then there's also, your everyday person who measures it. And we're getting better at measuring it ourselves. For example, I just got a smartwatch in July. I was skeptical about getting one because I was afraid I'd be obsessed with how many active calories I get, and I was correct. I am obsessed with that. But I find myself, I work out in the mornings. I go to CrossFit typically. I find myself going out for a quick 20-minute walk in the afternoon because of my smartwatch telling me I should. And so I think that it can have an impact on how physically active we are. From a research perspective, we also use trackers. We tend to use ones that don't give any feedback because we don't want that feedback impacting their physical activity. We don't want them doing anything out of the ordinary. So we tend to use sort of blinded accelerometers. It's the same technology as a smartwatch, a little bit better in terms of for research purposes. We do interviews, so we ask people how physically active they are, and then we have systematic questionnaires, but these are not great. Interviews are better because we can say, well, was that really, was that really at the moderate intensity level and so on. And then questionnaires are probably the worst way in terms of over-reporting physical activity. One thing regarding the guidelines that I think trackers has had an impact on is that basically it used to be that you had to do 10 continuous minutes for it to count as physical activity. Now they're saying there's no cutoff. And I think part of the 10 continuous minutes was it was hard for us to determine to measure physical activity sporadically throughout the day. But now with trackers, like 1 minute here, walking up the stairs and that counts, it can be counted. So again, there's not that 10-minute minimum of physical activity to count. And there is lots of good data to say that it doesn't matter if you do 3 10-minute bouts or 1 30-minute bout, it doesn't matter in terms of the health benefits. I don't want to get too much into this, the consequences of being physically active, the positive benefits, and then the consequences of inactivity are huge. It's been linked to all-cause mortality rates and coronary heart disease, heart attacks, diabetes, high blood pressure, and obesity. So just lots of negative consequences related to inactivity. So why aren't we active? So if there's all these health benefits, why? Sometimes it's related to convenience and availability. It's cold outside, you normally go outside, it can be tough. We'll talk a little bit about how to be physically active in the winter in a little bit. And it could be environmental, ecological factors, so access to sort of facilities. There could be an income issue, which are not being able to pay for a gym. It can be actual physical limitations, lack of time. And so, but research will show that people who exercise have just as much time available for leisure time than those who don't. So lack of time, even though it's a perceived barrier, it's not necessarily considered a actual barrier. Boredom, lack of enjoyment. Some people just don't like to exercise. And we'll talk a little bit about how that we can increase that a little bit later. Okay, so before I go on to some of the behavioral interventions, I want to talk specifically, I thought this was kind of a funny picture. Somebody figured out a way to not have to hold their phone while they watch it. And so we talk a little bit about sedentary behavior, which is different than necessarily physical activity. And this is a lot of words on a page, I apologize. But basically, it's sedentary behavior is any waking behavior. So sleeping is not considered sedentary behavior. It's anytime you're awake and you're expending 1.5 METs or less. So you're sitting, reclining, or in a lying posture. It doesn't include light activity, so just like walking around the house, it's more just sitting or lying down. And sometimes when you're seated, like if you're playing a cello or doing something active, it wouldn't count as sedentary, but most of the time, if you're sitting, you're sedentary. The research, I think this research is cool. I think it's awesome that we started looking at this. It's pretty new in the last 15 years, although there has been some seminal kind of studies that got us started a long time ago, like, for example, a study in 1953 that found that bus drivers had higher rates of cardiovascular disease than the conductors who were walking around and walking stairs and so on. So it's kind of an interesting first look at how sedentary behavior impacts health. Amount of sedentary behavior does not vary depending on meeting physical activity guidelines. So if you're a person who meets the physical activity guidelines, you're not necessarily being more or less sedentary than the person who doesn't meet the physical activity guidelines. So it's kind of a separate issue. Very similar in terms of sedentary behavior also has an impact on mortality rates. And again, the morbidity rates can be directly and positively impacted by the adoption of physically active lifestyle. So they have found that if you're sedentary, but you're also physically active, you can still have health benefits. However, there is some health consequences to being sedentary, to sitting a lot and still being physically active. So we have to think about, even if we are physically active, we still need to be not sitting as much as we do. So this is the exact sort of increase. So just regardless of physical activity, it's partially offset by physical activity, but not totally. We have a 47% increase in all-cause mortality, increase in diabetes, cardiovascular disease, mortality rate, some types of cancer, specifically endometrial, colon, and lung. They've also related it to overweight and obesity. And we just don't know if we'll talk about this and we talk about the guidelines in a second, but we don't know if it's important to break up sedentary behavior or if it's the amount of minutes you're not sedentary or what sort of we should be doing in terms of how little sedentary behavior we should be doing. In terms of the actual amount of being sedentary, kids are sedentary about 5 to 10 hours a day, and they have about 2 to 4 hours of screen time, not including school. Kids that are mostly home now, although I know we've seen some elementary kids go back, lots of screen time with that is school related. On average, adults are sedentary about 9 hours a day. I guarantee you, if you count it one day, you will find out how sedentary you are. Think about when you're eating, working, potentially, depending on your job. And when you're driving, there's all sorts of things. Even if you have an active job that you walk a lot in, there are a lot of other hours in the day that you're probably sedentary. It even gets worse when you're, it could get worse when you're older. 67% of those 65 age or older are about 8.5 hours per day. So again, when you get, it's about the same with older adults. And sedentary behavior has increased over time. So this is the percentage of you as children who view children video games. So you see a lot of sedentary behavior with that for more than 2 hours a day. My kids are in this category for sure. But you see a little bit of a dip when the kids start school at ages 6 to 8. And then it gradually goes up. And then as they start getting jobs and maybe start driving, it dips down a little bit, but definitely really peaks at age 15 to 16 in terms of getting more 2 hours of television, video, or playing video games per day. Okay, so sedentary guidelines. So how much should we not be sitting, or how much should we be doing light activity? We don't know yet. I keep looking for more research to come out on this, but I think the next time around, my prediction is we'll have it within the next 8 years, some guidelines that will come out with the physical activity recommendations. Hopefully it'll come out before then, but we just don't, there's not enough science yet to say, should we be getting up and making sure we're standing 2 minutes of every hour? Should we not sit for more than 30 minutes? Should we make sure to be active 10 minutes? Should we have no fewer than 5 hours of sedentary time a day? We don't know yet, like what exactly we should be doing. And then we also don't know much about how it impacts weight. So we know we expend more calories when we're standing. Does that have an impact on weight? And there's been some studies with treadmill desks that have shown that people can lose weight by just getting a treadmill desk because they expend more calories throughout the day. In 2011, Canada created the following guidelines: move more, sit less, limit screen time to 2 hours, both similar to recommendations we have. And they said to limit to motorized transportation and time spent indoors. So Canada was kind of the first to come out with some recommendations. Australia specifically defines prolonged sitting as sitting for more than an hour. And so they have a little bit specific. In US guidelines, like I said, the first one that came out is basically they just say move more and sit less throughout the day. So that was the recent ones that came out in 2018. Some of the interventions that are done is basically that they've done some behavioral interventions to try to decrease sedentary time. A lot of them have been worksite stations, so they install sit-stand workstations in workplaces, and they found a 77-minute reduction in sedentary time during the workday. And so the preliminary results indicate that apps may also be efficacious. So I know my watch tells me if I've been sitting for 50 minutes on the hour, it'll tell me to stand, which sometimes I'm at my standing desk. My desk goes up that I'm sitting at right now. And I get mad at it because it's telling me to stand and I'm already standing. So I start doing squats and that seems to help. But it doesn't always recognize, it just recognizes you kind of being still, I think. So there is some information on that in terms of that being helpful. And this is, again, a newer field, needing more research. Okay, so I want to transition out of sedentary time and transition into talking about exercising during COVID. One of the interesting things that have sort of come out of COVID, we've known this before COVID as well, in general, that people who are fit tend to deal better with illnesses, and they're starting to find that a little bit with COVID as well. The Zoom sessions have increased, so people who go to gyms and do group fitness classes, you've seen an increase in those being available. We have more sitting with working at home, which is a problem. And they've also found research studies that where kids are doing less activity during COVID. It tends to be a little more pronounced for older kids. So one specific study that came out in December, and this study, it takes so long to publish in our world. I hate it, but this was basically, they looked at pre-COVID rates and then rates in March and April. So what was sort of the acute impact of COVID. I wasn't able to find anything super recent other than this one, but basically they found that there was overall a decrease in physical activity levels from pre-COVID to early COVID times, and more of a reduction in Hispanic Latino adults. There was an increase for those already active at home. So people who are already being physically active at home tended to have a little bit more time. And there was also an increase in steps near your neighborhood. So you have seen a little bit of a trend, and this is documented in this study, in doing some walking outside. The physiological effect of masks. So now in Minnesota, you know that we all have to wear masks to gyms. Honestly, I've gotten used to it, but it does feel a little bit like I'm suffocating sometimes. But the participants in this study completed a maximal treadmill test using a surgical mask, an N95 with a respiratory, and no mask. And they found no differences in heart rate, respiratory rate, blood pressure, oxygen saturation, and time to exhaustion. So the physiological effects are pretty minimal, and there's been other studies as well that have shown similar effects. They did find that exercising with an N95 was related to end-tidal carbon dioxide levels, and it tended to be more prominent in higher loads, but just this one kind of finding. For the most part, very little effect physiologically. The psychological effect is another story. This particular study with 23 participants, they did a treadmill test again. They just did mask versus no mask. Heart rate was a little bit higher with the mask, 128 for mask, 124 for not. The RPE is basically, it's a scale that goes up to 20 in terms of your kind of rate of perceived, sorry, that should say RPE, not REP, rate of perceived exertion. And that was 12.7, so somewhat hard, versus 10.8, which is in the fairly light range. So that difference doesn't look like it's big, but it is in terms of it gets you into that somewhat hard range. So people were perceiving the mask as harder than not, even though according to the other studies, we're not really getting exact physiological changes. All right, I want to make sure to get to the practical implications, so I'll kind of go through what we've done a little bit quickly, but I want to get a sense of some of the research studies that we've done. What can we do to help? Well, we have behavioral interventions that, based on theories, and I'll talk about those in a minute, that can increase physical activity. So these can be in-person sessions, they can be group, individual, they can be over the phone, over web, text messaging, social media. So we found that these behavioral interventions can help increase physical activity, but many individuals are not reached. So there's a lot that actually doesn't work for. We don't know what happens after we stop these interventions. So we'll do like a 6-month intervention where we're calling people to try to motivate them to exercise. And then what happens after that 6 months? The problem is we get highly motivated people to sign up for our studies. So we'll have a control group where we actually do nothing with them, and they'll increase their activities from like 30 minutes to 110 minutes a week of physical activity because they were already motivated to be physically active. And we don't really do a good job of if the theories that we're using to inform these interventions, if they're helpful. And so when I say an intervention, like I said, it's something that someone is doing. It could be like just even accessing a website where it's designed, we're intervening, we're motivating people to exercise. We did a large study looking at, funded by the National Heart, Lung, and Blood Institute, to look at if we can increase physical activity by using theory-based strategies with them. And basically we wanted to see which theory-based strategies worked in this study. So we randomly assigned 448 active adults to home-based exercise with motivational messages to get physical activity. Back when the study was done, we did tailored messaging that we sent to them. And then we did a health wellness contact control, so we controlled for contact time. And what we did with them is we used behavioral strategies. And so what those were basically this idea of how do you take a sedentary activity and then substitute with physical activity. So if you're cleaning up the house, maybe run up the stairs 30, I did this the other night to get my calories in, run up the stairs 30 times. And after every 5 times, you're trying to clean up the house, do something around the house for three minutes and run up the stairs again 5 times. So you're doing a household activity and you're cleaning up the house like you need to, but you're also getting activity in at the same time. Enlisting social support, so getting other people involved and helping you be physically active, either being exercise with them or having them, take care of the kids and I'll go exercise. Rewarding yourself. I know when our kids are little, we'd have to negotiate who would go to the gym first, come home, the other one would go to the gym, come home. Someone would go in the basement. It was a negotiation in terms of who got to be physically active, but we were both supported each other. Rewarding yourself for being physically active, making a commitment, buying a new pair of running shoes, setting them out so they remind you to be physically active. Cognitive processes, we used this in the study. We found out in the study that these actually weren't as helpful. So knowing about the risks of being physically active and the benefits and the health outcomes, we found really that you can tell people that physical activity is going to help reduce your cardiovascular disease. You can say that over and over again. It will not motivate someone to be physically active. However, if you talk to them about how does it make you feel when you're done? What is your energy levels like when you're being physically active throughout the day? Those are the things that tend to be helpful. We also would weigh the pros and cons of being physically active with them. What are the things that they had to give up to be physically active? How did you feel about being physically active? And then we did some self-efficacy with them in terms of how to increase their confidence in specific situations like illness, bad weather, vacation, lack of time. The other important part of physical activity is self-determination theory, which is this idea that you want a physical activity to be intrinsically motivated. So how do you not extrinsic, like giving someone money for being physically active or how you look. So the extrinsic really aren't that motivating. Intrinsic is more about, it becomes a part of your identity of who you are. You exercise because you love it. And that's where we try to work to get to people. So some of the content is we did, like I said, pros and cons, we did goal setting, we had them monitor their physical activity, try to make it a priority, social support, like I talked about, strategy to help them enjoy it, their confidence, kind of problem solve, and then talked about making it a habit and how to prevent relapse. So we did find that the exercise group did increase to above the guidelines. So at baseline, they were doing about 20 or 30 minutes a week. And by 6 and 12 months, they were doing 170 and 190 minutes per week. So we did see a significant increase. But in the wellness, they also increased. So like I talked about before, it was that that basically they came in already motivated. I'm not going to get into the details of what this says, but basically we found out that enjoyment was actually really important. So confidence was necessary. So we needed to have people be confident, be physically active, but enjoyment was what really mattered. So we could figure out a way for people to enjoy physical activity that seemed to matter. So basically we decided based on this study that behavioral interventions, behavioral strategies are probably what in the enjoyment piece are really what's important. And this led to another offshoot study called Healthy Mom 1. And what we wanted to do with this study is so we knew this intervention worked. We applied it to postpartum women to see if we could help prevent postpartum depression. So we took women who had a history of depression or their mother had a history of depression and randomized them to multiple groups. And basically this idea that the 1/3 of women who had a history of depression or their mom had a history of depression were at risk for postpartum depression. So that's why we wanted to target this particular group. And we know that depression can sort of manifest itself a little differently than adult depression. So we wanted, even though research studies have shown that physical activity is just as effective as an antidepressant for treating depression. However, let me caveat that by saying that we can't always get people to be physically active. So if we can get them to be physically active, it can be just as effective. We just can't get them to do that often. So we knew it's effective, but we didn't know much with postpartum depression and it can be a different kind of depression, more of an anxious depression. We wanted to test it. So we randomized 130 people to that same kind of intervention or a wellness control. And we did find that people did were more likely to reduce their depressive symptoms, more so than the wellness group. So this led us to another study that we did, in terms of basically overall depression was lower than we thought, but our wellness condition did exercise more than we thought. So then we did sort of a no contact control in our Healthy Mom 2 study, which was our next study that we did to kind of look at mental health as well. And we randomized 450 participants to either home-based health wellness or usual care. And we did find that the exercise did help with stress. We did find that the exercise group did exercise more than the wellness and the usual care. So we got that finding did occur. And we did find that exercise was better for stress levels. And then our wellness actually helped with depression as well. So those are sort of the findings behind that. And again, a similar kind of intervention that we used than previously. So this led us, these clinical trials take 5 years. So we're actually, Healthy Mom 2 has been done for a couple of years. We're still working on publishing that. It's under review right now. So these are often 5-year trials. So the trials I just presented were from 2014 and published in 2014, conducted before that. So we're currently working on a third study that we've just finished. And we're working on the publication for this one as well. And what we did with this study is we took that same intervention and then we applied it during pregnancy. We targeted only low-income women, and we had them wear Fitbits as well. And this was a smaller study funded by the U.S. Department of Health. And these findings should be coming out soon as well, kind of in the writing stage. Before I talk about some practical implications, I want to talk about a recent HIT study we did, looking at sort of this idea, can we get people to do shorter exercise training programs that still meet the guidelines? Because one of the things that postpartum and the pregnant women talk to us about is that they don't often have enough time to fit it in. They wanted something shorter, like something 15 or 20 minutes. So we started testing this HIT intervention with regular adults. And we know that we can get people to increase the physical activity using HIT based on lab-based studies. But we want to see, can we have them do HIT at home? And this was pre-COVID. And so now, like, we know that people do HIT at home all the time through Zoom sessions with their gyms. But some of the things that we hadn't done in research-wise is that we hadn't really done the muscle strengthening exercises. That the HIT often was just like, go to a lab and bike. And the challenges of the perception that high intensity leads to an unpleasant affect. And we wanted to challenge that perception, because HIT, you could do like 1 minute on of high intensity, 1 minute off, 2 minutes on, 30 seconds off. There's lots of ways to do that. And so we wanted to sort of look at what are the kind of different ways we can prescribe exercise. So we randomly assigned 47 participants to the HIT or control. And we did kind of a combination of a website intervention and then also telephone calls to sort of use those behavioral strategies that I talked about to be more physically active. And so this is an example of, we had different workouts that they could choose from. And they were all things that they could do at home. So nothing complicated like pull-ups or lifting weights or anything like that. They're all body weight kinds of movements. It was a small study. We just wanted to kind of see if it was feasible, and people did like it. The only effect we had was basically the participants in the HIT group did more vigorous intensity activity, still pretty low levels at 6 weeks, and there's no difference at 12 weeks. But we didn't find very many differences between groups at the moderate and vigorous combination levels. But we hope to kind of do a little bit more on this. And again, I think the Zoom, I have a grad student doing a Zoom-based study right now. I have friends who, again, very anecdotal, that love doing their gym-based group exercise programs on Zoom. Okay, so I just want to end with some implications for policy and practice. So in terms of, I know I flew through I feel like that's the boring part, is talk about my research studies. I kind of flew through that. So if you have some questions on that, please let me know. I can go back to that. But what does this all mean? So we know these behavioral interventions are helpful. What can we do about it to kind of make a bigger real world impact on physical activity levels? Physical activity should be a vital sign. So just like blood pressure and heart rate, we believe that healthcare providers should also be asking about physical activity since it does have so much impact on health. Healthcare providers could be providing exercise prescriptions potentially. Again, I know time is often an issue, but asking about how much they're doing and how much they could be doing. Right now, physical activity interventions are not reimbursed by insurance. So it's not, unless it's for like specifically like cardiac rehab or something like that. So how do we increase physical activity? I know as an employee at the University of Minnesota, I have access to wellness programs, and physical activity is one of them. So sometimes through employer groups, you can have access to some of those interventions. You should look at parent classes, walking groups, and support groups, specifically for postpartum women, because that seems to be a time when physical activity is lost because it's a time issue. And again, but all of these things can be applied, walking groups, support groups, all of that could be to anyone as well, in addition to postpartum women. Something happened with, I did one interview with Winter Wellness and how to be active outside. And it ended up doing a bunch of different talks with that. So I've sort of accumulated some practical recommendations for what can be done in general for physical activity and what can be done in the winter. Basically, one of the tips that kind of came out of some of the talks I've been doing with this is tell yourself to exercise for 5 minutes. So if you're not feeling motivated, then just say, I'm going to do this for 5 minutes. And then if I don't feel like doing it anymore, I'm done. Not 99% of the time, that person will continue exercising after the 5 minutes. I do that sometimes when I wake up at 4:50 a.m. to go to CrossFit. I'm just not really going to go really hard today. And I tell myself that, and I get there and I do. So sometimes it just like helps motivate you to like, it's not going to be as bad as you think. And then it is. Okay, I set realistic goals. What is a realistic goal? Is it 4 times a week? Is it 5? Is it 3 times a week, longer sessions? What is a realistic goal? Track achievement of those goals. Seek out social support. If somebody has a family, it's complicated to be physically active. And self-efficacy, what kinds of things can you do to increase your confidence? And then the trickiest one is really the intrinsic motivation. So what is it about physical activity that person loves? So what is it that will get you to enjoy it? Is it distracting yourself in front of a TV while you're on the elliptical trainer? If that works, that's fine. Do you love to bike? I've seen a huge increase in, I was just in Hayward, Wisconsin, and the fat bikes with the big fat tires. I was very jealous of all the people out on the ski trail. Well, they were on the bike trails, but I was out skiing, cross country skiing, and watching these. It looked really fun. And so what is it that you can do to enjoy physical activity and embrace what you love about it? Sometimes people are uncomfortable about having their heart rate increased. And so learning to be okay with that is part of it. Simple exercises inside. I was talking to my dad the other day. He goes, he was talking to my uncle about how to be more physically active. And he goes, he does push-ups. I'm like, do push-ups on a wall. I mean, if you can't do a push-up and you can't do a knee push-up, do one on the wall. Doing things like burpees, air squats, walking up and down stairs, there's lunges. There's a lot of things you can do that are very simple inside. Embrace the outdoors. Cross-country ski, snowshoeing, things that are fun are important. Plan the week based on the weather. And I say Tabata is your friend. Tabata is something where you pick an exercise, like let's say you do air squats and you do it for 20 seconds and then you rest for 10 seconds. You try to do the same number for 8 minutes. So you do 8 rounds of that. So let's say you can do 5 air squats in 20 seconds. You do that, you rest for 10 seconds. You try to do 5 again in the next 20 seconds. And then you repeat that for 4 minutes. You can make a minimal investment in equipment. You can get a pull-up bar with a band that will fling you up there for like $40. And there's online programs as well. In terms of exercising outside, there is some data to show that it actually feels less intense when you're outside than when you're inside. Never take a season off, just embrace it. There's different things you can do outside. Layering, wearing lights. I like suspenders that illuminate. I feel like those are easy to put on. You don't have to worry about what you're wearing. Spikes, avoiding cotton. There's lots of things you can do to get outside. Again, check the weather and make a plan. I'd say some of the take-home messages are make exercise a part of your day, make it a routine, a habit, like I said, and make it enjoyable. focus on how you feel when you're done throughout the day, and then realize that relapses can occur. So you can get sick and maybe not exercise for a week. That's fine, but getting back at it. And then also making it a priority and no excuses. I know we're lucky to have this, but this is my gym and this is my 3 kids and a neighbor working out. And we try to be role models to our kids, and keep it, accessible for everyone involved. All right, and with that, I'll end, and I think we'll open up for questions.
Yes, thank you so much. We have a couple questions already in the Q&A. If you'd like to ask a question, you can go ahead and submit that through the chat or the Q&A. I'm looking at both of those. The first question is, can you talk about parents versus non-parents and caregiving as it impacts physical activity? And then also interested in the impacts of parents' physical activity on young people in the household. If you could talk a little bit about that.
So yeah, so parents versus non-parents. So I think obviously you have to be with parenting, you have to be a little more creative in terms of how you fit it in. A lot of parents I talk to in our studies, they're like, I have to get up early in the morning before my kids wake up to exercise. Or I exercise like if they're at sports and I find a trail nearby their sports or something to do something while they're at sports. I know 9:30 a.m. CrossFit's super popular for kids after they put their kids on the bus, so older kids. In terms of non-parents, yeah, exactly. I think that sometimes then you're, depending if you're working from home and then you have, I could do it anytime today, right? I'm working from home. I'll take a break at 11 and then it never happens. So sometimes there's a little more flexibility there. Caregiving, in terms of that, is a huge burden. I'm thinking of caring for older adults, for example, or a parent. And if they're not able to be active with you, obviously you're caregiving for them, so they're obviously not active typically. Again, the similar kinds of things as a parenting role would be in terms of how you're going to have barriers and there's going to be very limited time for that. So how to work it in early in the morning. And then second question again was related to role models.
For children in the household, maybe.
Yep. So I touched on that a little bit probably after that question came in at the end, but there's definitely data to show that being a role model to your kids plays a huge impact on being physically active. I think during COVID, my boys are big hockey soccer players and my daughter's a gymnast. It was like everything shut down. And I kept saying, we have weights in the basement, go in the basement, do in the basement, go in the basement. And finally, like after like 6 months, it like wore off, they finally did it. I don't know when I stopped saying something. But I think it's always like, hey, I'm going for a walk. Hey, I'm going to the gym. Like, just like it's a part of, you influence your kids and you start to see it. For those of you who are younger kids, you see it when they get to be teenagers. You see how that role modeling when you were a kid, when you were younger, or when they were younger, kind of starts to play off. So lots of the data to support that.
Great. Another question. What's your opinion on exercise snacking? Do you feel it is efficacious to physical activity adherence? And if so, to what extent?
So like exercise snacking in terms of like doing 5 minutes here, 10 minutes there kind of thing?
I think that might be what they mean.
Yeah. There was some, I'll talk about snacking, actual snacking too. I can address that. But there is some data to show that when you do 3 10-minute bouts, like I said, it's just as effective as a 30-minute, but there's actually some data to show it's better for HDL cholesterol when you break it up. So there is a little bit of data to say that actually breaking it up might be slightly better for you. And I don't know if it's because it's throughout the day. We need more research on that because I think breaking it up is going to make you less sedentary throughout the day, potentially too. But again, yes, that is completely fine to do it that way. In terms of, there is some data to show when you exercise, you tend to potentially snack more, like food-wise. And sometimes that's why we don't always see that effective physical activity on weight loss, because people compensate by eating more because they feel more hungry. So again, I don't know. Hopefully I answered that question one way or another.
Yes, the asker said they were thinking of just like short little bouts of exercise.
Yes. Okay. Yes. Good. Okay. Yes, exactly. Short bouts are totally and completely fine. Some people are more comfortable about getting sweaty once during the day and breaking it up. So really how it works for you. But again, there's some data to show that actually the small bouts might be a little bit better for you.
Cool. Another person said, thanks for your presentation. And a question about office-based workplace interventions. You mentioned adjustable desks, but these can be really cost prohibitive for a
Mhm.
large number of employees. Do you have recommendations for sustainable office-based workplace interventions? And then another question about standing desks. What are the research findings on the benefits of using a standing desk for work?
Yep. So there's a new study that just also answer the second question first. There's a new study that came out by with Mark Pereira from the School of Public Health at the University of Minnesota. Just did a really large study on that. If you Google him at the School of Kinesiology, or sorry, School of Public Health, and they did a big study, and they found some health benefits of standing versus sitting. So basically, they just got people to stand an extra hour a day, and they gave them a desk to do. So they randomly assigned people to desks or not in work sites, in 24 work sites, I think it was, and did find direct health benefits of that. So we know that, yes, they're very costly. We've started in our department, it started to be sort of the new standard for people coming in. So we're gradually replacing our desks. But standing is, you can't stand at a certain height. You just can't do it. So I would say get up, do some air squats, do some lunges, do some walking around. And I just like to say, like, every 30 minutes, get up for like a minute, because it really is it's more that expending energy, but it's also kind of your posture and where your weight distribution is going and all that. So if you can just break it up with some light activities, and if there's things you can do standing, like you don't have to be at your desk, like if you're on a phone call or something, or Zoom, and you can adjust your camera, think about things during the day that you may not need your desks to do, and then make sure you're standing during that time.
One person in the comments said that IKEA has an affordable sit-stand desk, so maybe that's a good option to look for.
And IKEA, I'm a big IKEA fan, and they tend to be good quality too. They're often hard to put together. Well, not always, but they're always like nice wood. So yeah, that's a good suggestion.
Um, Another question, can you speak about research that may be relevant for people concerned about a loved one's health due to their activity level?
So there is a significant amount of research that says social support is very important. Um, Nagging is not efficacious for increasing a loved one's physical activity. And like I said, too, the health, talking about how it might benefit your health. If it's an acute health problem that you can have an effect on, perhaps it could be helpful to talk about it. But I would say going for a walk with that person, making it easy for that person to exercise, and say, hey, I'll make dinner if you go exercise at 5 p.m. And so I think talking, like, actually behaviors like doing things are helpful, more helpful than nagging and saying things, like I said. So making it easy for that person to be physically active, and also being a role model for that person too is helpful.
Another question, two questions I'm going to kind of combine. So one said, can you speak a little about to how to work past the discomfort or lack of ability for people who've never consistently exercised or are overweight in a way that inhibits their abilities? And then a similar question, recommendations for people who are very overweight trying to establish a new routine.
Those are great questions, and I think I know this is somewhat relevant, but I remember my daughter saying, like, after her soccer practice, I think she was 7, she goes, I'm sweaty and I don't like it. I don't like the way I feel. And I'm like, no, we don't talk like that. No, we love exercise. But there is this idea that, like, it's uncomfortable. It's uncomfortable to be physically active. And so I think that think about the heart rates. If they Google it, it's 220 minus your age, and then the percentages you should be at is like 55 to 70% of that. So if you Google heart rate for moderate intensity, you can find out what your moderate intensity rate is. It's lower than you think. So you can get into the 125, 140 range, be at moderate intensity level, and that probably feels okay, and still get the health benefits of that. So you probably don't have to be as strenuous as you think. So one way is to make sure that maybe by getting sort of a Fitbit or something, if you can manage to do that, some heart rate monitor to see where you're at. So maybe you don't have to be as high as you think. Also, getting it into that vigorous range for just short amounts of time. So, like, I'm going to do this for 20 seconds, and then I'm going to take 40 seconds off. You would be surprised. You get your heart rate high, it comes back down to that moderate range, it goes back high. When you're varying it so much, and taking breaks, your heart rate stays pretty high. Like, you don't have to continue. If you want to walk stairs, you don't need to do it for 5 minutes straight. You can literally do it for a minute and your heart rate will probably stay high for another 2 minutes after that. So getting that intense part just for part of the time and staying in the moderate range, I think it can be super helpful. And overweight, a lot of times it doesn't take much to get into that. Just going out for a slow walk can get you into the moderate range when you're overweight. So just start somewhere, and just do it for 15, 20 minutes to start with. Go for a very slow walk and then work your way up. But online is some great resources in terms of American College of Sports Medicine. Some of those well-known associations will have some tips on specifically types of exercises that are good. And I think that really starting slow is important.
Great, thanks. One person asked if we could get access to a copy of your PowerPoint or list of references and maybe even some of those recommendations. So I'll follow up with you and share
Sure.
some of those if you have them available, that we
Yep.
can send some links or something like that in the follow-up
Yep.
email that I'll send tomorrow.
Yep. I have some good links, and like some of them, you can't always access the articles, but I have more links like to CDC and to American Heart Association, some of those things that I can share with you.
Yeah. And a note through the Hennepin-University partnership, we do offer to help Hennepin County staff if they're looking for some of those research studies. We can help them access those.
Oh, you can get out. Yeah. Okay. So I'll show some research articles.
Yeah,
too.
that's great. And we can help any county staff who are looking for those. They can email the HUP and we can help them out with that. Thank you. Another question, which would be better, to start exercising on an empty stomach or after having an energy full meal?
Oh, that's a really good question. Empty stomach, no, never. After a meal, I mean, it depends. Some people, this is kind of a personal thing. People can have huge meals and go exercise. Kids tend to do that better than adults. But I would say it depends on the person and figure out what works for you. I can tell you what I do. I eat granola before I go to bed at night, and I wake up and I eat a banana before I work out. I don't know why, but I think bananas are the best thing you can eat before you work out because it's got a little bit of sugar, some carbs, whatever. It's got everything you need. But I would say test it out. And I recommend not working out for an hour after you eat, unless it's just a banana or something small. So, yep, that's a really good question though.
What about an exercise ball used instead of a chair? Does it have any benefits that you know of?
So in terms of energy expenditure, maybe a little bit more because you have to engage everything. They have shown it's good for your posture and it also engages your core. So I don't know what the date, I think it does expend a little bit more energy, but I would say, I think it's good if you have access to doing that. It's probably better than a chair. Just being careful, you might want to switch it up because it can get a little bit hard on your back to always be in that posture. Just like standing, you shouldn't stand all day either. It's bad. It can be bad on your back. So just moderation of that.
Someone said, could you maybe expand on why you would wait to eat after a workout? They've heard that you should eat within 20 minutes.
Yes. Okay. So what I said is wait, if you eat, don't work out for like another hour after you eat if you eat a big meal. In terms of eating after, yeah, there's some data to show that you should actually eat fairly soon after you eat. Carbohydrates and protein combination is what they say. So yeah, some people will say 20 minutes, an hour, whatever. Yeah, you should eat after you're done working out for sure. Yep. Hence why you shouldn't probably have a huge meal before you work out either. So
great. And one more question has come in. What about cardio versus strength training for heavier people? What has more health benefits and what can people stick with better?
You can stick with whatever you like, number one. And I would say both. I think people always think you need to do aerobic training for overweight obese. That is not the case. That's not necessarily the case. I mean, strength training, when you're building muscle, you're building a higher metabolism, which you're bringing more ability to burn fat. And you can do both at the same time. So if you do a wall push-up, you are doing strength training and you're doing cardio, because if you do strength training in a way that gets your cardio going, you're really essentially doing both. We tend to separate like running, walking, biking in one category, and then everything else, strength training, or like we think of lifting, and we forget about like the burpees or the or the air squat or something like that, kind of in the middle, that gets your heart rate going and is cardio and muscle strengthening. So
Great. And one more. How about protein shakes? Can you talk about protein shakes, bars, or other forms of protein like that?
that's totally personal preference. I mean, there is a lot of data to say most of us do not get enough protein. And so if you're not getting enough protein in your I always say get natural protein if you can, because it's better. If you don't in your diet, then protein shakes are helpful. Some people like to have them right after they work out, and they find that helpful. But there is data to show protein is very important for everything, not just even muscle building, but everything. So yes, one way or another, make sure you're getting protein. Again, right before, right after, that kind of stuff is kind of up to you in terms of when you want to do that.
Great. Well, it is 1 o'clock. I want to say
Okay.
thank you so much again to Dr. Lewis for joining us for this webinar presentation, and to all of our attendees for joining us as well. Look for that email to follow up in your inbox from HUP, and always email us if you have any questions as well. So thanks so much, and we'll call it a day. Have a good
Okay.
one.
Thank you. Thanks for having me.
Thank you. Bye-bye.
Yep. Bye.